50% of the time, patients are like blown away, like, no one's ever checked this before. This is the most thorough exam I've ever had. Oh my God, I had no idea that something was wrong. If I did this and nothing happened here, but it happened there, well, that's a problem. That means a specific nerve is getting short-circuited over here. Sort of like if you have a tooth and it's bothering you, you don't fix it, it's gonna get worse over time. This is showing what happens over time to a spine, how it degenerates. The more accurate the diagnosis, the better the treatment and the better the outcome. And that's all I care about. I want the absolute best outcome for every patient. Sort of really simplified, but I like it, first grade level. We'll look at to see, like, has one of the, in the panel, has one of the circuits switched out? What's the underlying problem? How long has it been there? And then I can coordinate everything to come up with an actual game plan. So let's switch rooms. You can follow me, Mary. We'll get those x-rays. Well, hi. I'm Dr. Michael Pasternack. I'm a chiropractor. I specialize in auto injuries and wanted to discuss, well, why should you come in and see me? And that's a really great question. It really comes down to clinical excellence and my thoroughness, but let's break that into sections so you can see what I'm talking about, and then I'll wrap it up more sort of at the end. But so when a patient comes in to me, I'm always going to start out with a really thorough consultation. It's been said that if you really just listen to your patient, 90% of your diagnosis comes from listening to your patient. So it's so important. I really focus on corrective care, meaning instead of just trying to find your symptom and maybe mask it or something, I want to find the underlying cause and do everything I can to get that handled so you get the absolute best long-term result, because that's what's important to me and that's what's important to you. I'm going to go ahead and do an exam in just a second. Now, I'm not going to do the full exam. Normally, I'm going to check the whole spine. Even like in Mary's case, that it's her neck that's bothering her, I'm still going to check her lower back, because remember, I specialize in finding the underlying cause of someone's problem, and there may be things that are festering or brewing on the inside that aren't painful yet, and the patient doesn't even know it, but it's like a tooth that's decaying, and the next day all of a sudden they could wake up in pain. So I'm going to be thorough and check everything on every patient. Then when I get to over here, right over or left over here at this level, that one joint is sort of stuck or not moving properly. So that's something we're going to want to address as we go along. Now I'm going to do just a quick screening to see if there's any maybe cardiovascular insufficiencies I need to pay attention to. Go ahead, turn your head as far as you can and bend it back. And any dizziness with that? No. Right, so I'm checking that. And then I'm going to do some orthopedic tests, which means that I'm checking the joints to see. So again, I'll go like this and I'll put some very gentle pressure. Now, of course, if I push hard, that can make anyone say that it hurts, so I like to go super gentle. So any discomfort with that?
A little bit,
right. One, right, and so I would notate that in my chart, and then of course I would do the other side. So that's like some of the orthopedic tests that I would do. And again, orthopedic tests is a fancy way of saying I'm checking the joints to see how they're working. Then I would start getting into some specialty tests, some neurologic tests. And I know I like to keep things at a first grade level. So if I ever use a fancy word, I always then try and dummy it down so that it makes sense. So forget I even said the word neurologic test. I'm going to do some nerve testing to see. And so when I say the nerves, if we look at this chart over here for just a second, so you can see this is just showing sort of the nerve distribution. So you can see like the brain would be sitting up top here. It connects to the spinal cord, which comes down, and over here you see the bones of the spine, which is surrounding, so you don't really see the spinal cord, but it would be in the middle, and then you see all these nerves coming off. So the point being, I'm going to do some nerve testing, and so Mary, as I'm doing the exam, in her mind, she's going to think, well, he's checking my arms because I'm going to be doing some testing and some reflexes on her arms and some sensation. So she's going to think I'm checking her arms. So I'm going to tell her, hey, Mary, by the way, so I'm going to do some nerve testing with you right now. I'm going to check some reflexes and some sensation and some muscle strength. And you're going to think I'm checking your arms. But I'm really checking to see, is it getting short-circuited over here where that nerve's coming out, sort of like this poster right behind us over here. Sort of really simplified, but I like it, first grade level. I'm looking to see, like, has one of the, in the panel, has one of the circuits switched out. So that's sort of what I'm going to be checking for now. Now, each reflex I check, by the way, is checking a specific nerve. So I'm going to check this and see how that arm jumped. That's good. That's what we want. But it doesn't tell me anything until I compare it to this side. So that was equal, so that's good, that's normal. If I did this and nothing happened here, but it happened there, well, that's a problem. That means a specific nerve is getting short-circuited over here, right? And I'll check another reflex, like I'll check here, and then I'll check this one here. I have to say, when I do this, I hear probably 50% of the time, patients are like blown away, like, no one's ever checked this before. This is the most thorough exam I've ever had. Oh my God, I had no idea that something was wrong. It's because I'm super thorough. So go ahead and put your arms out for me. And so does this feel the same as that? So we're looking for the same right now, and I would check there's different levels that I'm checking. So does this feel the same as this?
Yes.
See, that's good. And you can relax. So I would check that side to side at all the different levels, and any of them that were abnormal, each one indicates a different nerve or a specific nerve, so it would let me know where the irritation is. So the point of all this is, remember I said that I really focus on finding the underlying problem. So instead of you just coming into me saying, yeah, I have neck pain, and I'm like, okay, well, let's put a little ice on that and hope it gets better. No, let's do a super thorough consultation. Let's do a super thorough exam and see, okay, instead of saying, well, it's just you have neck pain or you have muscle strain, well, how about saying, okay, well, you've got a nerve that's being pinched at the C5. Now we know exactly which nerve it is, where it is, because the more accurate the diagnosis, the better the treatment and the better the outcome. And that's all I care about. I want the absolute best outcome for every patient. And that's what I would want as a patient. In fact, I just got in a car accident and I have some problems, and so I need to go to someone too, but we'll talk about that in another video. What's the underlying problem? How long has it been there? And then I can coordinate everything to come up with an actual game plan. So let's switch rooms. We take the x-rays right here. I take the x-rays, I read the x-rays, and so, it's convenient. I don't have to send you off for that. I'm gonna really coordinate and make sure that everything's being done, one, in a timely fashion, and that you're taking advantage of every possible treatment opportunity that could really offer you benefit to help get you the best long-term result. Because that's, at the end of the day, that's the most important thing for me, is getting, one, getting patients feeling better. That's sort of the easy part. But two, improving the quality of their life, and three, making sure that, we help them to maintain that on an indefinite basis. And so I would explain how, these are plastic models. These are the discs over here, and you could see how these discs are getting more dehydrated, and basically it looks like beef jerky by the time it gets over here. You can see the bones over here in white, they're smooth, the edges, and you can see over here how you're getting bone spurs that are being deposited over here, and you can see how it totally fuses together over there. And then if we turn these to the side for just a second, you can even just look at, here's the nerves coming out in yellow, here's the spinal cord, but look at the nerves, how big they are. And then you can see as the condition progresses how that nerve is getting smaller. I mean, look at them next to each other. Look how small that's gotten. And then eventually that leads to what's called stenosis, or really probably more nerve atrophy. It's like it's totally choking off. And so if you'd like to learn anything more, if you want to leave a comment, certainly feel free to do so at the bottom, and we'll help you any way we can. Thanks so much.